You're listening to the Monday Night Community Show with Daniel on BRFM.
This is the Daniel Monday Night Community Show on demand through YouTube. Thank you very much for choosing to listen to us through this method. If you'd like to keep up to date with when I add new interviews, then subscribe to this channel. So we're going to be talking to John, all part of the regular slot I do. Firstly, thank you very much for speaking to me. Would you be able to introduce yourself first?
Yeah, no problem at all. Thanks for speaking to me. My name is John Chambers. I'm the Senior Exercise Physiologist for the Cardiac Rehab team, so the Community Cardiology team. We cover the whole of Medway and Swale for people with recent diagnosis of heart problems.
So I was hoping we could start off by you letting us know why it is important to look after your heart.
Yeah, certainly. I mean, the heart is, although it's quite a small organ really, is something that the whole body depends upon. It's absolutely vital for us. The heart generally, as an approximation, pumps out 23,000 litres of blood through our arteries every single day. And this carries the oxygen that our lungs bring into us and the food, the nutrients from the food that we eat around our body and to the organs where it's needed. If this oxygen supply, blood supply is reduced or interrupted in any way, so the heart is not working properly, then our whole body starts to fail.
So what can damage the heart then, John?
There's lots of things. Smoking is a big one, drinking too much, eating the wrong types of food, or really doing little or no exercise are the real big things that damage our heart, as well as the rest of our body, of course. And they certainly can lead to long-term health conditions such as heart disease, obvious one, but also obesity and diabetes.
Well, I was hoping you could cover diabetes for us next.
Okay, well, diabetes, certainly in Swale, is we've got one of the highest rates of diabetes in the whole of Kent. We've got over 5,000 people in Swale alone who have been diagnosed with diabetes, but they think there's another 500 people who are walking around with it who don't know anything about it. Symptoms, generally speaking, things like feeling thirsty, feeling very tired, you may get blurred vision, but also you get poor wound healing as well. But the awkward thing is not everyone who has diabetes gets obvious symptoms, so they do continue to feel a little bit unwell and not really do anything about it. Sadly, it is a lifelong condition. At the moment, there is no known cure, but it can be treated. But if it isn't treated, then it can cause a lot of serious health problems. Heart disease is one of them, but it can also cause nerve damage, blindness, and it can even lead to things like amputations and limb loss. So
is there any way of stopping it then?
No, as I said, there's absolutely no cure for it at this time. It can be treated. There are lots of medications out there to bring it under control, to sort of readdress the balance within the body, but unfortunately the best way really is to not get it in the first place. And small lifestyle changes can make a big difference and really reduce the risk of developing diabetes. And it's things like making sure you are exercising, you're eating healthy, you're not overweight, you're cutting down on alcohol and stopping smoking.
Well, I'm probably guessing the answer to this is none, but how many cigarettes is it safe to smoke? No,
you're absolutely right. It is absolutely none. There's lots of people say, I only have a few, or I smoke roll-ups, or I smoke cigars, so they're perfectly okay. And unfortunately, that isn't the case. Absolutely none is the only answer. Cigarette smoke from any form will damage and clog up our arteries, damages the heart muscle, so it becomes less effective. But it also clogs up our lungs, so really it does just limit what our body can do, and it limits how our body can work. It starves our body of oxygen and blood, and as I've already said, this is vital to how our body functions. Without that, we don't function properly. We know that stopping smoking isn't easy. Nicotine is really addictive, but a lot of health professionals out there can either give you direct advice on how to stop, or can point in the direction of the people that can give you that advice.
So are e-cigarettes safe, John?
Well, at the moment, we don't really know. They do contain some nicotine, and although that is the addictive chemical within cigarettes and can cause some health problems in itself, it's not the most harmful chemical within the cigarettes. So there is, there's certainly the thought is at the moment that in comparison to smoking ordinary cigarettes or cigars, it is relatively harmless. Unfortunately, we don't know at the moment. It's being investigated, but the investigation isn't really going to end until about 2016, so we won't know fully until then.
So what about eating and drinking too much?
Certainly eating and drinking too much, something that we all do from time to time, and I think, comfort eating, at this moment, everyone feeling a little bit stressed, a little bit pressurised, is very, very common, but it can be harmful, particularly if it's the wrong sort of stuff. High fat, high sugar foods and drinks are particularly harmful. It's important to recognise if you do have a problem, if you are eating too much or if you're becoming dependent on food, and again, it's coming back to your health professional and getting either advice directly from them or pointing in the right direction. Generally speaking, though, the advice would be to eat a big variety of food, particularly make sure you've got fruits and vegetables in there as well. Alcohol in small amounts, probably not going to do you much harm, but in excessive amounts will certainly do a harm and could certainly damage your heart, your liver, and maybe even your brain as well, and that's obviously something we need to avoid.
Now, John, I know you next wanted to move on to exercise.
Yeah, I mean, we discuss exercise in a great deal of detail, and I have done for many years. And certainly for some people, particularly some of the older generations, exercise is really seen as a very dirty word, and it brings back memories of, having to run around a hockey pitch or a rugby pitch when they was at school and absolutely hating every minute of it. But fortunately, it doesn't have to be like that. Any exercise at all, any activity, that makes you feel like you're breathing a little bit harder, feeling a bit warmer, but you're still remaining comfortable, is exercise. And that's really all we're asking people to do. The guidelines state that you feel that way, so breathing a bit harder, feeling a bit warmer for 30 minutes on most, if not every day of the week. To improve your health, that's probably not too much to ask for many people. But even small changes, such as walking to the shops rather than driving, taking the stairs rather than a lift, can really make a big difference to a lot of people. And gyms these days are quite friendly places, believe it or not. But if that really doesn't, interest you in any way, there are lots of walking groups, there's cycling groups, and lots of other things, even like dance classes, anything like that that you do on a regular basis will improve your health. And at the end of the day, if you find something that you enjoy, you will keep doing it, and that's what's important.
So how can our listeners find out more about help and that kind of thing?
Well, at the moment we're quite lucky. We're in Swale. There's a free, what they call an NHS MOT health check, and that's in the Forum Shopping Centre in Sittingbourne this Friday, which is the 9th of January. There's no need to book for this. You just turn up, and it starts at 10 o'clock and it finishes at 2, so any time between there. And it's part of the NHS Swale Clinical Commissioning Group, touring Beats and Breathes roadshow, so really looking after our heart and lungs as well as our general health. Within that, there'll be a team of nurses and health trainers on hand to perform some fairly simple, uninvasive checks for your heart, your lungs, as well as looking at weight and height, and any other concerns you may have. This may hopefully pick up anything that you may have, and if it is likely to be a problem there, that they can point you in the right direction, refer you to your GP or anywhere else to get that help. And some people may walk away from there having got a clean bill of health and feel quite good about that, and what a way to start the new year. But if there is anything there, it's best to stop it early and get it sorted out than it is until it becomes a serious long-term health condition. They can also give advice on things like exercise, healthy eating, drinking within safe limits, and stopping the smoking. Apparently it takes about 20 minutes, which is, again, for your long-term health, isn't a lot to ask for, and it works a bit like a car MOT, so a good thorough check. And at the end of it, you've got a certificate as well, and I've written down any guidance that you may need.
Well, John, if you're happy we've covered everything, I'd like to thank you very much for doing our regular slot this time at the beginning of January.
No, it's been an absolute pleasure talking to you.